Hi everybody, Tim White, clinical specialist here with the Aspen Center. I am with one of our most recent patients, Brittany, who has just finished her course of capsular contracture treatment here. And as many of you know, we do a lot of these videos to help patients understand the condition of capsular contracture, women who have had breast implant surgery, whether cosmetic or reconstructive, kind of help figure out maybe some of these symptoms that you may be experiencing after surgery. Brittany has agreed to kind of tell about her experience today, and hopefully if this is something that you're suffering from, you now are aware that you have a non-surgical option to treat these conditions versus thinking you can only have surgery. So Brittany, thanks for being here.
Pleasure.
Awesome. So Brittany has completed her course of treatment. She is being discharged from a round of therapy that we had done for her. So tell everybody a little bit about your experience. You've had 2 total surgeries. You had 2 bouts of capsular contracture. Correct. So kind of let people know what your history was.
Okay. I've had 2 total surgeries, as he said. Basically, I didn't know what it was. I originally went in there to, get my boobs done, thinking everything was okay, everything was fine. Long story short, I noticed a lot of hardening, a lot of pain, and thinking I knew what it was, I tried to fix it, and realizing that it wasn't something that could be done with another round of surgery, but something that needed to be done with a doctor.
And you had probably gone through the normal course that a lot of our patients do, which is you did your best to try and massage it, and the doctor probably recommended massaging. Sometimes they recommend medications. Did your doctor put you on any of the asthma medications or recommend vitamin E or anything like that?
He didn't recommend any. He recommended, I forget what it was. It was
either the Accolade or Singular.
No, it was like strong drugs. It made me sick. I threw up. I told him I couldn't take it. I ended up going off all pain meds and flushing it down the toilet, and it was just me and my kids I was taking care of.
Oh boy. Okay. So in some cases, doctors will recommend certain asthma medications. The brand names are Accolade or Singular. Those medications I feel have a certain amount of help in the beginning stages after, let's say, a capsule revision surgery. But my experience has been once you actually encapsulate, so once the breast becomes asymmetrical or higher or harder, I personally have not seen those medications work. I'm not sure what it was that your doctor had recommended. So in Brittany's case, she had 2 surgeries, both by well-known surgical centers, and your last surgeon is a very highly reputable plastic surgeon who has an excellent history of clinical skill. I'd like to explain to my patients, it's not the surgeon, the surgical center, or the type of implant. It's the fact that all of us, our bodies automatically create this capsule condition, and in certain patients overcreates or overbuilds that capsule, and in your case, yours had overbuilt on both sides.
Correct.
In Brittany's case, she has a bilateral contracture in which one side was worse than the other. So for kind of a visual understanding of what's going on, when implants go in, the implant goes inside the body, and then this natural shell begins to grow around it, and this pink balloon, which represents the capsule, is the tissue of the capsule that's made by you. So the surgeon doesn't make it, the implant company doesn't make it, it's the patient that makes it, and in Brittany's case, she is just overdeveloping this scar capsule. And we know this because you've had 2 different surgeons, 2 different surgical centers. I mean, the odds of 2 complete different approaches or doctors or physicians being able to basically try and get you the best result, and you encapsulate each time, we kind of have to look back at the lowest common denominator, which is it's just us. And we see this in a lot of women. Really great surgeons do great surgeries, and patients keep re-encapsulating 2, 3, 4, 5, 6 surgeries later. Our option, the Aspen treatment, provides a non-surgical solution, which clinically is a better option because we have a much higher success rate, and we have a no complication rate. In other words, there's no bad things that can happen with the treatment. Worst case scenario is a small percentage of our patients don't see a result. Now you got great results. So
yes,
we looked at Brittany's results today. We looked at the kind of the asymmetry or the measurements of how her breasts were off in the beginning and how firm they were, and today we rechecked her breast on how soft they are and how much more level or equal that they are. The most important thing is it's not what I think as a clinician, it's what Brittany thinks. So your overall assessment of how much softer both breasts are on average would be what? 0 to 100?
Before the treatment, they were like, I mean, one was not as soft, but more like a water balloon. If you tried to squeeze it very hard, and just it didn't feel right, and I was upset. And they looked completely just off. I mean, one was higher than the other, one was lower than the other. Coming here now, I'm so happy to say they feel 100% to me better, and there's no pain anymore. There's completely, now I'm happy to wear a bathing suit or a bra or be confident about my body now, knowing that, you know, it was something that could have been fixed without, you know, going back under the knife.
Excellent. Yeah. Brittany did great. Her results are great. Some other symptoms that patients will notice, like in your case, report of this benign pain. You know, my breast hurts, or when I lay on that side, or if I'm in the bed and I'm face down, or, you know, I roll over at night, I just remember how much my breasts hurt with compression. That's all a function of this capsule. This capsule has nerve endings. And when things squeeze, no different than if someone had a knee surgery or a shoulder surgery, when scar tissue builds up and it tightens around things, it causes pain. And these pains are very poorly treated with pain pills or injections or topicals, because until you treat the tightness and you treat the scar tissue, the pain persists. So in your case, that was resolved. Let's talk a little bit about the treatment. So the treatment we use, our proprietary technology, which is our Aspen system technology, which is a sound wave generator. The sound waves are used to resonate and cause the capsule to loosen. So not only do you receive the treatment here, but patients get a home program. And that's really important, because it's not only what you see with the results of the technology, but the compliance in being able to do this at home is what creates the end result of taking this tight compressed capsule and being able to stretch it and elongate it and be able to get to a position of where the breasts were high and tight and asymmetrical, and now they're symmetrical and soft.
Correct.
Great. Well, Brittany, thank you very much. Listen, if patients have any questions, would it be okay to maybe share your email or a phone number? If they have any questions, they can call you as a reference or whatnot. Awesome. Thank you very much.
Awesome.
Well, if anybody has any questions, we offer free consultations. We chat on the phone. You can actually come in-house. We'll take a look at you. For any of our patients who are not local to us, we do offer remote online evaluations where you send us some information and you send some pictures for us to look at the shape and the symmetry, in which we can give you kind of a grade, how severe you are, and if you are a candidate for treatment. We offer a fast track course here where patients from out of town can fly in for a 1-week treatment. Any questions, give us a call. Our main number, 954-341-7875. Like us on all the social medias, and don't be afraid to subscribe to us on our YouTube channel.